Introduction to chastity. Virginity and chastity are terms often used in the context of female physiology and sociocultural norms. Physiologically, virginity is associated with the presence of the hymen, a thin membrane that partially covers the vaginal opening. However, chastity carries a broader meaning, encompassing moral, ethical, and cultural dimensions. In various cultures, chastity may symbolize purity, restraint, or preparation for marriage, but these interpretations vary depending on traditions and religious beliefs. Physiology of the hymen. The hymen is an elastic tissue present in most women from birth. It can take various forms, from ring-shaped to perforated or even solid. In some women, the hymen may be absent or so thin that it tears unnoticed, for instance, during physical activities, tampon use, or without any apparent reason. Importantly, the presence or absence of the hymen is not a reliable indicator of sexual experience, as it can be damaged for reasons unrelated to intercourse. Cultural significance of chastity. In many societies, chastity is linked to moral purity and preparation for family life. In traditional cultures, preserving virginity until marriage may be seen as important for family honor. However, modern perspectives often move away from such stereotypes, emphasizing individual choice and freedom. Chastity as a social construct is gradually losing its significance in many countries, where the focus is on education, self-respect, and health. Myths and reality. There are many myths surrounding virginity. For example, it is commonly believed that losing virginity is always accompanied by bleeding or pain. In reality, this depends on individual physiology, hymen elasticity, and psychological state. Another myth is that virginity can be verified. Medically, this is not possible, as the condition of the hymen is not a universal indicator. Education in this area helps debunk stereotypes and reduce societal pressure on women. Psychological aspect. Virginity is often tied to personal beliefs and self-perception. For many women, the decision to preserve or lose virginity is deeply personal and depends on their values, religion, or desires. Psychological comfort and readiness for intimacy play a key role in this process. Pressure from society or a partner can cause stress, so it's crucial that the decision is voluntary and informed. Conclusion of Episode 1. Virginity is not only a physiological state but also a complex socio-cultural phenomenon. Understanding this concept helps women make informed decisions free from stereotypes. In the next episode, we will explore how virginity is lost, the physical and emotional aspects involved, and why it is a natural part of life. How does losing virginity happen? Losing virginity is typically associated with the first vaginal intercourse, during which the hymen may stretch or tear. However, as mentioned earlier, the hymen can also be damaged in other ways, such as through sports, tampon use, or medical procedures. In some cases, the hymen is so elastic that it doesn't tear even after multiple sexual encounters. Physically, this process may involve mild discomfort, pain, or slight bleeding, but many women experience none of these. Emotional component. Losing virginity is not just a physical act but also a deeply emotional moment. For many women, it marks an important milestone in starting their intimate life. The emotional experience depends on factors like mutual trust with a partner, personal readiness, and the social context. A positive experience is often linked to mutual respect, open communication, and a comfortable atmosphere. Conversely, pressure or haste can lead to anxiety or even trauma. Physical preparation and health. To minimize discomfort during the first sexual experience, it's important for the body to be relaxed, with sufficient foreplay to ensure natural lubrication. Using lubricants can also help. Women should know that persistent pain or discomfort is a reason to consult a gynecologist. A medical consultation before starting sexual activity can help understand one's body and avoid complications. Social pressure and stereotypes. In many cultures, losing virginity is surrounded by myths and expectations. For instance, some societies expect women to remain virgins until marriage, while others view it as a personal choice. Modern perspectives emphasize the importance of autonomy and consent. Women have the right to decide when and with whom to begin their intimate life, free from fear of judgment or stigma. Medical aspects. After losing virginity, it's important to pay attention to health. Using contraception and protection against sexually transmitted infections is crucial. Regular gynecological checkups help maintain reproductive health. If questions or concerns arise, consulting a doctor can alleviate fears and provide necessary information. Conclusion of Episode 2. Losing virginity is a natural process that can be both physically and emotionally significant. It's essential that this experience is based on mutual consent, respect, and readiness. In the third episode, we will explore how conception occurs, the physiological processes involved, and how it relates to women's health. How does conception happen? Conception is the process of fertilization, where a sperm merges with an egg to form an embryo. For this to occur, intercourse must take place during ovulation, the period when an ovary releases a mature egg. Ovulation typically occurs mid-menstrual cycle, around day 14 of a 28-day cycle, though this varies individually. Sperm can remain active in the female body for up to 5 to 7 days, increasing the chances of conception. Physiology of the process. After intercourse, sperm travel through the vagina, cervix, and fallopian tubes, where they may meet the egg. Only one sperm, or rarely, multiple, penetrates the egg, fertilizing it. The fertilized egg, zygote, begins to divide and, after a few days, implants in the uterine wall, marking the start of pregnancy. This process depends on factors like hormonal balance and reproductive system health. Role of women's health. For successful conception, a healthy reproductive system is essential. Regular menstrual cycles, absence of infections, and adequate hormone levels contribute to successful fertilization. Women planning pregnancy can consult a doctor for health assessments, take folic acid, and adjust their lifestyle, e.g., quitting smoking or excessive alcohol consumption. Emotional and social aspects. Conception is not only a physiological but also an emotionally significant process. For many couples, it's a conscious decision filled with joy and anticipation. However, unplanned pregnancies can evoke mixed feelings. Support from a partner, family, or professionals, psychologists, counselors, can help navigate emotional challenges. Contraception and family planning. If conception is not desired, contraception is key to controlling reproductive health. Various methods, from condoms to hormonal contraceptives, allow women to decide when they are ready for motherhood. Education in this area helps prevent unwanted pregnancies and maintain health. Conclusion of Episode 3. Conception is a complex and wondrous process that combines physiology, emotions, and personal choice. Understanding this process empowers women to approach family planning consciously and care for their reproductive health. Together, these 3 episodes highlight the importance of knowledge, self-respect, and freedom of choice in matters of virginity, intimacy, and motherhood.